My name's Chloe Nicholson. I'm the Ageing Well lead in Lincolnshire ICB. I work very closely with Mark Turt and the team in Lincoln, and of course yourself, Andrea, to hopefully provide you all with a series of useful informal training, if you like, and updates. So hopefully these are helpful to you. I'd just like to welcome to the session Francis. I'm trying to find you. We've got 3 pages of people here today.
Yeah.
Francis
I'm
Kelly.
in here. Yes.
Hiya, Francis. You're on page 3 of all of our delegates today. We've got Francis here today. Francis is going to give us a really useful overview of the Lincolnshire Bladder and Bowel Support Service, and specifically around the continence provision that we have in Lincolnshire. So without further ado, Francis, if it's okay, we shall bring your slide deck up. We'll have your slides, and then if you're happy to, Francis, open up for any Q&As, and I'll keep my eye on the chat function for you. Is that all right with you? Yep. Okay.
Before I
Andrea,
share the slides, I was going to say, just before I share them, do you want people raising their hand if they have a question, or would you rather that all went into the chat?
We will have a session for the questions at the end of the presentation. Okay. So if there's any burning question that they think they might forget, by all means they can note it in the chat to make sure that we do address it. We don't want anybody to get missed out from the queries. Okay. What tends to happen is if people pitch in part way through with a question, I invariably lose my track.
That's absolutely fine.
We've got a session for it at the end there. Lovely.
Can you see your slides now? They've just come up.
Yes, thank you.
Lovely. Okay.
Now, does this mean I'm going to have to say next slide, please?
I'm afraid so, and it's not fantastic. Even PowerPoint. It's a PDF for some reason, but it's fine.
Oh, bless you. Lovely. It's not PowerPoint. Oh, that means all my little animations aren't going to be there. Oh, not to worry. You'll have to imagine them.
Yeah. Sorry, some reason it's been sent as a PDF, so I do apologise.
Well, I do. I send it out just for your information as a PDF, so you've got a fixed hard copy, and that can go out to the care homes as well as is. The problem is if I send a PowerPoint out, it can get sort of manipulated and what have you. So,
alternatively, Francis, if you would rather us not share the version that you sent to me as PDF and upload your interactive version, just whilst, if you want to do that instead.
Well, I can share my screen from my end if that's all right with you. Is that okay?
Yeah. Sorry, folks, bear with us because then we'll have your interactive bits, because we've just got the PDF version that you sent to us, but it might be that you've got some fancy bits in your version.
No pressure.
Oh no, sorry, that's not meant. So what we'll do, Andrea, then, if we send out the PDF version, but Francis, if you're happy to, thank you, share the original version we're on the screen today. Thank you for bearing with us, folks.
Lovely. Right. How does that look?
Great, Francis.
Is that thumbs up?
Perfect.
Perfect. Thank you very much. Oh, don't want to get too excited. We've only just started. I hope nothing sort of drastic goes wrong with the technical side. Hello, everybody. I think there's probably some names that I do find familiar within the chat function, but for those of you who aren't aware of who I am, I'm the account manager for Ontex Healthcare, and we started supplying you for a second time on the 30th of September last year. And from my perspective as the supplier, whenever you change from one brand of pads to another brand of pads, inevitably there's a few questions that come to light. Some patients need to have their continence prescription reviewed, and general queries and what have you. But if I can be honest, the concerns and comments and queries from the care home sector wasn't as high as I thought it would be, and I can only put that down to the fact that either you guys are absolutely on the money, or a lot of you remember us from when we were your continence supplier the first time round, and that was between 2011 and 2018. So I think from when I have spoken to a few staff in care homes, they do remember us. So that's always a good start. So as you can see from this slide, The purpose of the session is to help you understand how to manage incontinence and give you a bit of an overview on the resources available to you. So this is the agenda. This is what we're going to talk about today. And I think obviously number one, very important for you guys, you want to understand the care home referral pathway. The purpose of this session is not to teach my grandmother to suck eggs, because I dare say there's a lot of you who are already familiar with this process and you don't have any problems with it. But for some of you on the meeting today, I dare say that you're going to find this useful. So moving straight in. Now, I don't know how well you can see this on your screens at home, but this is the pathway that the bladder and bowel team work from. Can you all see that quite well? Stick your hand. I mean, obviously you're going to get a copy of it. Yeah, lovely, thank you. This is where I might need to put my glasses on.
Can't see it.
There we go. Hang on, just 2 seconds. Oh, that's brilliant, lovely, thank you. So the referral goes into the bladder and bowel service, whereupon it is triaged. And when it's triaged, obviously you can imagine that if everybody says it's top priority, that's not really going to help the service manage these referrals in an appropriate manner. But if you have an end-of-life patient or a palliative, and obviously those two things are quite different. End of life, we're really talking the last few weeks of life. Palliative obviously can be a much longer period of time. But if you get a resident admitted, or they suddenly become end of life as a classification, then you were going to have to make sure that you document that within your referral, so that gets sort of triaged very, very quickly. So the patient is added to the waiting list, care home pending paperwork, and an email is sent back to the care home acknowledging this. So the patient's nearing the top of the waiting list, which is about 14 weeks. The bladder and bowel team will email the continence questionnaire to the care home for completion. And then the waiting list will be amended at their end to paperwork sent. So that helps them keep on track, because you can imagine there's a lot of care homes. If no response is heard after 2 weeks, and what they're after is for you to have completed that paperwork and sent it back into bladder and bowel. If they haven't had anything back from you within 2 weeks, they will contact you to see what's going on. And if there's no response after 7 days, they will be discharged. You can imagine that, it's a bit of a, we'll help you, but we do need your help in return. The work does have to be done by the care home, and I know some of you might already be thinking that the paperwork that you have to fill in is a little bit onerous, it's too complicated, or it's just too time consuming. It's absolutely essential, as we'll come on to in a moment. Once the paperwork is completed and returned to the bladder and bowel email address, a visit will be created and they'll be removed from the waiting list. So what that means is effectively you've been through the process, and one of the bladder and bowel team will come and see you. And they all do have their own care homes that they look after. And I dare say quite a few of you on the call today will know who that person is. Okay. So this is the paperwork. You may not be able to see it if you're looking on a laptop. It would be quite small, but it's a questionnaire. And all of those questions are pertinent. It's addressed to the care home. Jenny. Yeah, so whatever email is on file, and that could be manager at Rose Cottage, whatever, or it could be a person. It's best if the bladder and bowel team have the office or the admin or the manager or the deputy manager email address, because if it's a person with an nhs.net, like say David Jones at nhs. When that person leaves, that's an email that's now inaccurate. So it's useful to have the office or the admin. Now, if you can see the bit that's been highlighted in yellow, I didn't highlight that in yellow. I think the bladder and bowel team did, and I'm pleased about that, because this is really, really useful information. You can see it's asking for waist measurement in centimetres and hip. Okay, it is important, and if you haven't got a tape measure within the home, please do get one, and because it is going to make a huge amount of difference. So I'm sure you're familiar with this paperwork. You've got your bladder diary on the right, and you have to fill in 3 days worth of that. And then on the left, you've got your Bristol stool chart and a place to record all of the bowel motions. I will come on to this in a second, but I really can't stress how important it is that this is filled in. So the bladder and bowel team, they don't know your residents as well as you do. They don't know their sort of idiosyncrasies. And I dare say on a day-to-day basis, I'm sure the staff in the care home, they know the residents intimately, but I have to say, once you see 3 days worth of bladder diaries documented, it's very, very enlightening. You tend to see patterns that you might not have been aware of before. So you might see that they regularly have the bowels opened at 4 o'clock in the morning. Well, that's relevant, obviously. If any of the fluid intake is missing from the bladder diaries, and this bladder diary obviously is purely for a continence assessment. Quite a lot of care homes now have got their own handheld digital devices where you're documenting all of your episodes of care with your food intake, your fluid intake. So you've got that quite often as a central point within the office, within your database. But on a day-to-day basis, for the residents who are having their assessment, we do need this to be as accurate as possible. If you know that this resident drinks 8 cups of tea minimum, and there's only 3 cups of tea documented, the bladder and bowel service, they won't know that there's anything missing from there, and they will take that as gospel. And I'm not saying that the whole assessment hinges on the fluid intake, but it's pretty up there, as you can imagine. You could get 2 residents that present very similarly, but Mavis drinks 1.5 litres and Fred drinks 3 litres. So they're clearly going to have a different outcome. You'll see that there's a column to add in accidental leaks. That's really, really useful because that it all paints a picture. And it does say urine output in mils. Don't worry about that. If you feel that that it's not appropriate to get a jug and measure the urine output, don't worry about that. You could just put pad wet plus. That would probably suffice. Right. Now, on this slide, these are my words basically. The other information came from the bladder and bowel team. Just a little bit of an aid memoir, just to stress the most important points. And as I've said, please complete the charts accurately. But one of the things that often does get missed out within the bladder and bowel diaries is you might document cups of tea, you might document a glass of juice, or whatever they need with the medication. But quite often you might miss out a good 300 to 400 mils of milk that's gone onto the breakfast cereal. And a lot of staff kind of forget about that. And I think sometimes they think that has to be documented as food, as a food intake. But, if you're giving a resident a couple of Weetabix in the morning, well, you know how absorbent they are. You can get a good 300 to 400 mils of milk on 2 Weetabix if you want it to be on the sort of soft side. And that's almost a full pad's absorbency there straight away. So you really don't want to miss that out. I guess the key point is, if it can be turned into urine, you need to document it. Once the bladder and bowel team have been out to see the resident, they might decide to send some samples in. I don't know if you've been through this process before. They will send some samples out that we provide free of charge, and it's normally a day's worth of pads. And they will rely on feedback from the home on the success or the failure of those samples. And the samples might include one absorbency that's intended to be used for during the day, and another pad with an absorbency or type that's, its purpose is for overnight. So you're going to have 2 different ones to try. And the bladder and bowel team need feedback on both of those. It's useful during the assessment process when they're in, is to decide on which member of staff is going to be the link person to provide that information. From what we see, sometimes when the bladder and bowel team phone a care home, have you got any feedback on the samples we sent for Fred? And sometimes either it's just gone by the wayside, I don't know what you mean, it wasn't passed on. So this bit's quite important. So it's useful to have a named person within the home who'll be contacted to provide feedback on the pads. When to carry out a reassessment if your resident's condition has changed. And I think day to day, your residents, you sometimes don't see the change. You don't see that they've lost weight, gained weight, or that their mobility has started to slow down. And that in itself can be an indication that their current pad prescription no longer meets their needs. And you do sometimes see this when they're running out of pads. Now you all know that you get your pads delivered every 12 weeks. They have to be ordered a couple of weeks in advance. All the pads arrive together. It's absolutely carnage in the foyer. They all arrive together and someone's handed some paperwork and you've got to go through them line by line and make sure that the correct pads go into the correct rooms. I think housekeeping of pads is something that's quite important as well. So if you've done all of the work to do continence assessments, you want to make sure that when those pads get delivered, they do end up in the correct room on the correct resident. But if you're ever in a situation, and you know, I'm certainly not apportioning any blame here, but if you're in a situation where pads have run out, or you're finding that the wrong pads have ended up in a resident's room and they're not theirs, or there's an element of, well, Fred's run out, so we'll just borrow some of Mavis's for now. These things do happen, and I know that you're doing it with the best of intentions. You don't want that resident to be without a pad. There are better solutions to that. But if you are taking one person's pad to use on another resident, then obviously not only is that kind of theft, it makes it very, very difficult to say, well, who actually needs a reassessment? You want to just make sure that that resident's pads are only used on that resident, including the fixation net pants as well. And then if you're starting to see that they always run out at week 10, you haven't got enough pads to last till week 12, then, you know, that will tell you that that person is using more pads than they're actually prescribed. And it means we can then do something about it and try and find out why. Okay. I'll be open to questions at the end, so you might already have some burning questions following on from that. So, introduction to Ontex and the support we provide for those of you who aren't familiar. As a major company internationally, we do make some products that you're probably familiar with, apart from the ID range that you have in the care home. We're a leading manufacturer of not only baby nappies, but adult and feminine hygiene products. And you can see we do make them for a lot of supermarkets as well. But we're a big team, and you know, we are well resourced. But we do put the customer at the heart of everything that we do. The support that we provide for the care home, we've got a team of 20 nurses across the UK, and I don't think any of the other companies have a team of nurses quite so large. Within Lincolnshire, obviously, we have a team of 3. We've got myself, and I'm supported by Naomi and also Lindsay. In terms of resources that you can have day in, day out, we have the Ontex Knowledge Hub. The card that you see on the screen with the QR code, we do have those as cardboard cards, and whenever we're in a care home, say we're doing any training face-to-face, we would hand those out. When you do get the PDF copy of this presentation, you will be able to scan that QR code from the PDF, and it takes you to the Ontex Knowledge Hub, and you can see that there is an access code there, which is case sensitive. You'll see videos on how to put pads on. We know that quite often in care homes at night, staff don't always get access to the training, so this is a little bit of an additional support for them. I'm sure they're very busy throughout the night, and there's plenty of jobs for them to do in between the rounds. But you know, some of these videos just take a couple of minutes to watch, and it's quite useful. Okay. In addition to this, e-learning. We love e-learning, don't we? And obviously, since COVID started, All the care homes had to move across to a lot of e-learning for the mandatory training, which I understand you have to pay for. This is completely free of charge. We have 14 RCN accredited modules. They are, when I say they're RCN accredited, that's no mean feat. We have to reapply for it every couple of years. And if we don't make the grade with the references, if they're out of date or they're not accurate anymore, they've been superseded by something else, the RCN will tell us, and we've got to pull our boots up and get looking and get those updated. So for the nurses in the room, what this means is you can put this towards your NMC revalidation because of that RCN accreditation. I'm going to go on to what the modules look like on the next slide. But I've mentioned nurses, but it's also available for all healthcare professionals. It's not pitched at nurses. It's fairly flexible and accessible. So just pausing for a moment so you can read what the modules are. At the moment, looking at that, we've not mentioned pads once. Okay, this isn't Ontex trying to promote or sell more pads. It's really to help you understand incontinence. If you and this is from conversations I've had with staff in care homes. There's 14 modules, and sometimes they look horrified. Oh, I haven't got time for that. Oh, that sounds like too much work. It does make sense to start at module 1 and work your way through. However, if you've got if you're really pushed for time and you want to take something useful out of this toolkit, module 8 for your care staff, really good module. If you just did that one on its own, I would say if you have any staff within the care home who you have allocated to be continence champions, I really would like them to do all of these modules. But if you've got some carers who are a tad reluctant, tell them to do module 8, very quick. And then you can see modules 9A and 9B are paediatric, so disregard those if they're not appropriate to your area of work. But you can see modules 10 onwards, they are standalone modules, and quite a lot of them do apply within the care sector, as you can see. Okay, and at the end of every module that you do, there are 10 multiple choice questions. You complete them. You get a PDF certificate of achievement emailed back to you, so you can ask your staff to email their certificate of attendance to you if you're the manager, so you've got that on file. They can print them off if they want to go old school and put it in a ring binder because it looks nice. You've got all your certificates there. That's quite useful. But in terms of CQC inspections, whilst this isn't mandatory training, I do hear on the grapevine every now and then that the inspectors do ask a few more probing questions on continence management within the home. And I don't know if you've ever been on the receiving end of that, but it would be useful if you could pull out a ring binder and say, here's all my staff, they've all done this training, and here's the evidence. It wouldn't hurt. You might get a few brownie points. So in terms of how we've supplied Lincolnshire specifically, we were asked, well, we weren't asked, how can I put it? Our predecessors, which was Tenor, we were told that Tenor used to provide a monthly Teams training session to all of the care homes. And so obviously, as we were coming in as a new supplier, we said we'd be more than delighted to continue that. And as I've already discussed with Chloe, and some of the care homes that I have been into, a lot of staff have said, well, I wasn't aware of that. That didn't come our way. I think I've had one care home who was vaguely aware of it. So I don't know whether they just, it had been a thing back in the past. You may remember or you may not. And it just dwindled and it just was abandoned. So what I did at the start, I created 6 appointments running from Feb to July. We had a reasonably good session in Feb, good attendance, less in March, and it's going down. So we had nobody this month attend, and I think last month we only had 1. So you can see either there isn't an appetite for it, or you feel like your staff don't need it, or as I say, it's just one of those things in amongst the hundreds of emails that you get every day as a manager. This has just gone off your radar. But if there is a genuine appetite for this, we will continue with this. From our perspective, there's 250 odd care homes that get pads delivered. And this is a very good use of our time to be able to capture as many care homes in 1 hour. So we would be happy to continue it. Any particular care homes where they're really having a problem, we occasionally get asked by the bladder and bowel team to arrange face-to-face training. So it's not that that's completely off the table. We would do that. If we are going to arrange face-to-face training and we come to the care home, we do prefer that there's a minimum of 6 to 10 days, because sometimes we have to drive long distances, and quite often we get there and there's only one carer and the gardener or the laundry person, and it doesn't really make much of an impact for that time and that expense, if you see what I mean. So we do, we would like six staff minimum. The things that we cover within the training, whether it's face-to-face or the online session, obviously we talk about different types of incontinence just to make sure we're all on the same page, we understand what we're talking about. We spend a lot of time talking about product fitting techniques, because 9 times out of 10, if there's a problem with pad leakage, it often boils down to this. Okay. Moving on, we've got care fixation nets. Now, this is a really interesting one. If any of your residents are prescribed the shaped pads, they can have fixation net pants included within their prescription. If the resident declines and they have capacity and say, I don't want to wear them, I'd prefer my own underwear, I think that can make your life better or worse depending on which way you look at it. If they've got reasonably good underwear, good full briefs, good elasticity, that looks like it's going to be supportive enough to hold the pad still, keep it in place, fair enough. But quite often that's not the case. It could be that their underwear is slightly on the loose side, the pad moves, it could be a gentleman that's wearing boxer shorts. We've all seen it, haven't we? The pad's hanging out the boxer shorts leg. Worst case scenario, it falls out of the trousers as they're walking down the corridor. So we do need to sort of try and rectify that wherever possible. And the fixation nets are a big part of that. If you've got 20 residents within the home, all different sizes, and they're all getting fixation net pants, the reason why we add this as a particular point of topic within the session is to make sure that you understand the importance of obviously labelling the net pants before they've even left the office, before they've left the foyer. When you're checking the pads in on pad delivery day, on that bit of paper it'll say Mavis. I love Mavis. I don't know who she is, but Mavis is a name I always come back to. Mavis has got medium nets this time round. Let's find Mavis's medium nets in the boxes. There they are. Take them out, get your laundry pen, or you might use those button systems for labelling underwear. As I say, you've got to take them out of the bag. They come in bags of 5. You've got to label them before they go into circulation. If there's any nets in the building with no names on, this is the unpleasant part of the discussion. I hate talking about this, but really, if there's any net pants within the home that don't have a resident's name on, they really shouldn't be used. They need to be discarded, because they are underwear and they're single, they're for that individual only. They're not to be shared. Okay. And the other thing is, unless you've got it documented somewhere what size nets the resident should be wearing, if you haven't got that written down somewhere, then they could be wearing a pair of mediums on Monday and then a pair of large on Tuesday, and on Wednesday they're in 2XL, and it's all a bit of a mess, really. What was that, Heather? Sorry. What was the question from Heather? I'll answer that one now. Hang on.
Sorry, Francis.
Oh,
Heather
yeah.
asks,
Yeah.
Sorry.
Yeah.
You've got it first. Sorry, that wasn't much help.
No, there you go. I've opened up my chat bar there now. So, Heather at Monson. Am I right in thinking that Monson's just purely nursing, or have you got residential as well? Answering. I thought Monson was just nursing. Am I wrong? Does anybody know? Do you know, Chloe?
I can't recall. I'll go and do some digging unless Heather can confirm. I'll do some digging behind the scenes.
Yeah, so I have been to Monson many years ago, and oh, was it? Oh, right, okay, thank you, that's absolutely fine, scrap that. Yes. Are we putting another session on? What do you think, Chloe? Yeah, can do.
Yeah, absolutely.
Oh, thanks, Heather. Thank you.
Thanks,
Lovely.
Heather.
And
we can absolutely do that. Whatever care home colleagues would like, and if you're happy to support, Francis, we can either do it through this approach or or continue your your check-in monthly call catch-up meetings, whichever. Maybe that's what we could chat through. Brilliant. Francis.
Thank you. Yeah, definitely. So as Chloe's just said, after today, we really hope that this has sort of made you more aware of the monthly sessions that are available. So what we're doing now is we're just sort of going through an overview. So the fixation net pants, we do dwell on that for a little bit, and we talk about the laundry of them as well. Skincare, obviously big part of it. Storage of products, it has to be somewhere dry and cool, not in, damp attics, leaky basements. Troubleshooting, that's really, really useful, because I dare say on a day-to-day basis you might be having issues with skin, or pad leakage is a big one. You might feel that the pad isn't absorbent enough, or the size of the wraparound isn't big enough. So these are things that we can go through on the call. Housekeeping of products. When I do my face-to-face training sessions, I actually do this at the very beginning, oddly enough. I will, after I've introduced myself, I'll ask a few questions about the care home, as in, do you know how often your deliveries come? Do you know roughly how many pads per 24 hours of residence are prescribed? A few little questions, so that gives me a sense of how well the staff understand continence management within the home. And if they know, yes, they come every 12 weeks, yeah, they get about 4 pads. Sometimes they've got 3 in the day, 1 at night. We know they've got net pants prescribed. That tells me that that they're kind of on the ball. If I've got carers in front of me who don't know any of this, and we're kind of starting from scratch, I will tailor the rest of the session accordingly, based upon how they understand the housekeeping of the products. So if there's a continence champion that checks the pads in, they're also the same person who's placing the order. They know what pads go in what rooms. They are a great resource within the home, and it's useful for the rest of the staff as well, so they know who to go to if there's a problem with pads. So as I say, if there's a continence champion within the home, that certainly makes our life a lot easier, definitely. And then we talk about the additional resources which we've just gone through, which is the knowledge hub and the e-learning modules. Any questions? Right, the floor is open. How are we going to do this? Because we've got 3 pages of attendees.
We do. Well, what we tend to do, Francis, if it works for people, people tend to put any questions or any queries in the chat, which we can pick up on your behalf. I suppose just some initial reflections from me. Francis, I being relatively new to the Lincolnshire system, I found that really, really helpful. So I'm hoping that colleagues on the call did also. I think you provided demonstrating a really useful, solid offer there, and I think whilst not the core priority, it's a free offer in a health and care system that is particularly stretched. So I think I would urge colleagues, if you find that helpful, grab it with both hands, and we will share that and the links and the presentation with everybody after this call. Are there any particular questions that anybody would like to raise with Francis?
I've got a question for the care homes, if I may. Do any of you have problems with running out of pads before the delivery comes? And if so, is it different residents each time? Or is it always the same one? Oh, here we go. Hang on, let's open up the chat. What we got? Bowels. Yeah. So obviously you know that the assessment is only as accurate as the day, basically. You've seen the paperwork and the questions that need to be completed with the bladder and bowel diary. Sometimes when the pads then arrive and you start using them, and you're quickly using more than 4 pads in 24 hours. And sometimes you can't tell that from just the samples that you've tried. Sometimes it takes a couple of weeks before you realise, hang on a minute, we're going through 5 or 6 in 24 hours. What's the reason for that? Now, it could be that when you filled in the bladder and bowel diary that you didn't record all the drinks. That could be a reason. That could be a factor. It could be that the underwear is not supporting the pad in place. So if the underwear is not supportive, or the fixation nets are not the right size, and the pad's got that ability to sort of move down away from the body and maybe move when the resident's walking around, you're going to get pad leakage before the pad has come up to its sort of capacity. That's going to cause another pad change before it needed to happen. So that could be it. Obviously, if you've got residents with dementia, it is a big challenge, and it does come down to the type of pad. I dare say you've all been in that situation where you've got residents who keep taking the pads out and discarding them, hiding them away, flushing them down the toilet, all that sort of thing. The continence team will always try and prescribe a shaped pad first and foremost. And you've seen these pads before. I've got one here. How well you can see that. You can see I've cupped and shaped it into a boat. Number 1 rule for all pads. Pads have all got to be put into a boat shape before you pop it on. It could be that that the net pants that go with this just aren't the right size. Now I'm just going to draw your attention back to the paperwork that you had to fill in. If you remember, there was a couple of bits highlighted in yellow, and that was the waist size. Without the waist size, how can we prescribe the right size net pants? So it's crucial. And if it was, say, a lady with a small waist and larger hips, you'd do the hip and the waist, and then they'll kind of work it out from there. But the net pants, as you're aware, become colour coded to show you what size it is. This is a medium, just for reference, but we've got small through to triple XL, so everyone's catered for. It could be that, let's say, you've labelled them with Mavis's name. She's a medium and she only wears her nets. However, it could be that they've been put through sluice washes and tumble dries. They're good for 50 washes as long as you don't ball wash them and tumble dry them. They're great if they're just air dried in the laundry room on one of those sort of little hangers that you put your socks on. And then you keep the integrity, you keep the elasticity. If they go through the tumble dryer a few times, it's like a pair of tights. The medium will now have the size of a large or an extra large. So you're still giving Mavis her nets, but now they're not the right size for her. And sometimes it's difficult to figure out, well, why does that pad keep falling out? And it could be that. So the devil is in the detail. It could be, like you say, someone's mentioned bowels. Oh, hang on, I've just seen who's put that one in. Lindsay. Oh, 11 pads in 24 hours. Right, where do you work, Lindsay? Description. Okay. Abigail. Okay, thank you. Just to go back to the assessment process, it's my understanding that the bladder and bowel team, they want to prescribe the right amount of pads to meet that person's needs completely. It's not designed or intended to be a contribution to their continence care. If the information provided at the assessment or the reassessment phase is fully inclusive and accurate, then hopefully they'll be able to give the right amount of pads in the right type and the right absorbency. So it's not just about having more pads. Sometimes it's about perhaps a higher absorbency, and that higher absorbency might only be needed for nighttime. perhaps. Within the bladder and bowel team, just to tell you what the hierarchy is like, they've got band 3s that do a lot of the care home visits and what have you, and you've probably seen them already. There's band 5s. There's also specialist continence nurses who are band 6s, if you understand the banding system. But it's not until you get to the band 7s, and there's 4 of them, that that they will authorise either high absorbencies, different prescriptions that aren't on the basic list. So there is a basic list that the bands 3s, 5s and 6s work from, which will cater for sort of 90% of patients, either in a care home or at home. And if when they say they've reached the max prescription, obviously I don't, without knowing the details of that resident, Lindsay, there are pads that may be available that they may actually look at, but then it could be actually, it's not about the how can I put this, it's not about just giving more pads or a higher absorbency. Sometimes there's other things going on, and it wouldn't be rectified with a higher absorbency. And the example that I set for that is if you've got pads that keep leaking all the time, usually the first thing that's asked for is, can we have a higher absorbency pad? It's not absorbent enough because it keeps leaking. If you're aware, the pads have all got wetness indicator lines on the back. I'm just going to hold that up to the screen. Now you can see that bit's dry. You've got a yellow line that's now turned blue. You've got a blue line that's now smudged and faded. So the amount of liquid that's in this pad is sort of there to there. So you can see that bit's dry and that bit's dry. If that pad leaked, giving a higher absorbency wouldn't resolve that problem, because some of the urine's gone in the pad and some of it's gone overboard. So we need to get a lot more information to figure out truly what is the issue here and how can we resolve it. So 11 pads in 24 hours is pretty going. She's already on the max prescription, so I have to get fine. Okay, right. Yeah, I mean, obviously, fecal incontinence is a bit of an issue. As long as, yeah, four pads in 24 hours is really where it's at. Occasionally, very occasionally, some people might be allowed 5 pads but a lower absorbency, and that would allow you to change it more frequently because of fecal incontinence. Is there any number of times that resident pad is supposed to be changed? Okay, Erica, that's a good question. It's some people ask, how long should I leave the pad on for? And I think maybe in the past many years ago, people used to feel that a pad should last for 8 hours or 12 hours, or and if you've seen the adverts for baby nappies, they'll say stay dry for 12 hours or such like that. If you were to call a pad an 8-hour pad and they filled it in 2 minutes, it's not an 8-hour pad. So that's why we don't use that description. We describe the pad according to how many mils of urine it will hold. And that's determined by the amount of the absorbent powder that we put into the pad. So it's about matching the absorbency within the 4 pads to that person's fluid intake. So when we're looking at what looks like a good 24 hours pad usage, and again, bearing in mind, I'm not saying the pad should be left on this length of time, but when we're looking at 4 pads in 24 hours, you want pad number 1 to be the one that they get on first thing in the morning when they get up. You want that to last till at least about lunchtime. That's pad number 2 going on. Tea time, pad number 3 goes on. And then pad number 4, you really want that to be the one that's going to get them through the night. And I think quite often, if you've got residents who've got 4 pads of the same absorbency to work round the clock, that doesn't promote good sleep, I think. It might work for some residents, but I think a pad that's got enough absorbency to last from breakfast to lunch, lunch to tea, tea to bed, okay, you're now asking that pad to go from bedtime to getting up in the morning. And what invariably happens is they have a pad change partway through the night. If you've got a resident who always has their bowels open during the night, there's no point in giving a higher absorbency because they're not going to get the benefit. You're going to have to change that pad. But for a resident where you want to promote good sleep, bearing in mind that the residents that ask to go to bed at 6 or 7 o'clock, that's not when the nighttime pad would go on. Because then if they were going to go on to the night pad at 6 p.m, well, that's not going to take you through the full night at all. So that would be sort of like the third of the day pads. And then when the night staff come on and they're doing their rounds and doing their checks, that's when the nighttime pad goes on, and it should be sufficiently absorbent to get through to at least 6 or 7 o'clock in the morning in absorbency terms. And that can be done. That can be done. Okay. We have planned care day on the mobile device that helps. Okay. I mean, I am quite realistic. I've worked in a nursing home myself. I know you've got to have some sort of a routine. You can't be constantly changing pads. Although I think if pads leak, I was in a care home last week somewhere else, and they said we just feel like we're constantly changing wet sheets. You know, people get wet all the time, and that's all. That feels like all we're doing. And the problem there was net pants. They weren't using net pants, and it was sort of, you know, very loose underwear, a boxer shorts. So there was a potential resolution for that. You want that pad to stay on until I don't know if you can see the wetness indicator line starts there. I'm just going. Okay. So the pad should stay on till about two-thirds of the line has changed colour. 2/3. So we're not asking you to leave it on till it's reached full capacity. 2/3 gives you enough time to sort of get it before it's completely full, and you're able to sort of get a bit more use out of the pad. What sometimes happens in care homes is they'll see a bit of colour change and they'll change the pad. Either that's what they feel is the right thing to do, or they've been told to do that, and that comes down to a lack of understanding about how these pads are made and all of the technology that's inside. They're made exactly the same way as baby nappies. They've got the waterproof anti-leak barriers. They've got the absorbent powder that locks the urine away, helps to prevent ammonia forming. So it reduces the risk of moisture associated skin damage. But again, it's got to be in the right place. It's got to be against the body worn, not flat underneath the patient in bed. It needs to be inside close-fitting underwear or fixation net pants. Is it normal for a resident to stay the whole night without wetting her pad? To stay the whole night? Well, I'm not sure what you mean by that. Without wetting her pad and without a toilet help. So, like, they're not passing urine at night at all, if that's what you mean. I mean, I wouldn't say it's abnormal. Occasionally it does happen, but I think it's probably more likely that they will be passing urine at night, especially if they've got any issues with a bit of heart failure. You know, if you've seen residents who've got swollen ankles in the latter part of the day, that's fluid that's sitting there. And if you're in that situation, they go to bed, all of that excess fluid, that edema that's sitting in the lower legs, when they become horizontal, it gets reabsorbed and excreted by the kidneys overnight. So that kind of increases your nighttime urine output. What you can do to avoid that is to elevate the legs in the latter part of the day to help. But for a normal, healthy, functioning bladder and kidneys, when you go to sleep at night, your brain sends a chemical to your kidneys to say it's now nighttime, and it concentrates the amount of urine that you produce, which is why your urine's a bit darker when you first get up in the morning. And that's also to help you get some good sleep, so you don't have to keep getting up in the night to have a wee. Now, if you get woken up in the night because your bed's wet, there's no way that you can wash them, change that sheet, change the nightie without them being fully awake. So you've now woken them up. You have to do that. And that causes a little bit of a dilemma then, because then the brain says, oh, it must be daytime now, and it wakes the kidneys up, and the kidneys start going into day production mode. So that kind of can compound possibly a poorly fitted pad. So they go from one wet bed to another. But what I would ask you, certainly focus on the night staff and say, if you're having wet beds during the night, please ask them to have a look at those wetness indicator lines before they throw it away. Now, if If they've had a bowel motion, yes, the pad has to be changed. No, that's that. But if the bed is wet, have a look at those lines. If any part of those wetness indicator lines are still bone dry, but your bed's wet, it's not the absorbency that failed. It's not the pad that failed. It was the fact that urine went somewhere you didn't want it to go. And was it because no underwear was used, no net pants were used? Was it because the resident decided to take the pad off? There isn't a pad in the land that can kind of withstand being hiked out by the resident in the middle of the night. But the best thing that you can do is obviously we're going to cup and shape the pad so it's more comfortable. Make sure the underwear or the net pants is the right size so it's nice and supported. So when they're lying on the back or on the side, the urine will be caught within those anti-leak cuffs. It gets absorbed into the pad and you're going to have a dry bed. So can the bladder and bowel team help support people with complex catheter care? Yes, reach out to them for catheter care, absolutely. But I refer to the team. This was to drover's call. What have you done? What inappropriate referral? Right, okay. Without getting involved in the ins and outs of that, did you not say why? Oh gosh. Well, that's intriguing. We all want to know what that was now. Yeah. By all means, just email them back and say, can you explain why? Because you need to understand why. I'm just skimming back through. So, Erica, I dealt with your question.
Sorry, Francis.
Are we running out of time?
Drover's call has just said that they just returned the. Sorry, just going back to that inappropriate referral. So would you expect the bladder and bowel team to explain the reason for a return of a referral? Yeah.
You think so? Yeah.
Yeah. Okay. So would you suggest that if they were to query that and ask for a rationale for the reasons?
Mm-hmm.
Yeah. Okay.
Yeah. Can I just go back to Lindsay as well with the 11 pads in 24 hours? Where you've written down, it's just when she asks for the toilet, it's a sudden feeling. Are we talking about bowels there? I mean, if she's having 11 pad changes because of fecal incontinence into the pad, just to focus a little bit on bowels, the normal range of bowel motions is anywhere from 3 times a day to 3 times a week. Everything in between there is normal. You can go 3 times a day every day. That's still classed as normal. To have your bowels open more than 3 times a day, and when I say bowels open, what you do sometimes get, certainly within care homes and certainly within residents with dementia, if you understand how dementia affects the pathway from the brain to the bladder and the bowels, if they don't get that sensation that they've got a full bowel, you've probably been in that situation where you get a resident who's nursed bed to chair and they have to be hoisted. You get them up into the hoist and they've got that position where the knees are higher than the bottom, and that usually promotes a bowel motion to happen at that point. So you've got to have your wits about you there. And they don't have the wherewithal to be able to evacuate the bowels fully, so you're left with some fecal incontinence just smearing the pad thereafter. And again, that's going to force you to change that pad, unfortunately. But we need to go back to the drawing board and say, why have we got every pad change there's the smearing of feces? Like, what stool type is it? It's not normal to have copious amounts of stool type 6 and 7. It could be that you want the bladder and bowel to give you some support on aperients and bowel medication. Quite often residents get prescribed stool softeners, and you may be allowed to miss a dose. I don't know if that's included within the prescribing, where you can miss a dose if the stool type is 6 or 7. You may have that built into the prescription. But I have been in care homes where they routinely, as prescribed, give that stool softener day in, day out, and they've got copious amounts of 6 and 7 stool, and it's not impaction with overflow. So you think, well, is that the cause of the diarrhea, of the liquid stool, that somebody just needs to say, hold on, you know, they don't need to be taking stool softeners every day.
Okay, thanks, Francis. Linda's provided a little bit further context there, but I'm conscious of time, and I just wondered whether, given what you helpfully said at the beginning of the session, you'd mentioned about how you had put on these monthly, I suppose, monthly check-in sessions that you were doing, for want of a better word.
It's a full continence pad training session, so it goes into a lot more.
Right.
Yeah, it's a full training session covering those points. And are you going to ask me for the date of the next one?
I was, yeah, because I'm just thinking, I don't know whether people on the call feel that it would be useful to have further details about those, and is there an appetite for people to attend those? You've helpfully offered to extend that. I think you'd said that there was one more session booked for July.
That's on the 16th. That's on the 16th at 2 o'clock.
Right. And that's via Teams, is it, Francis? Sorry.
It is. What I can do is I can, as I say, when I first emailed them out, I had all of the 6 session meeting links all in the one email. But what I can do is I can do another email out to all of the care homes. I've got you all in a mailing group. And just to let you know, the email addresses that I used were the ones that I was given at the start of the process, that NHS supply chain used to send your pad orders to. So the assumption is that it's correct.
And I wonder whether, Francis, if it is of help, maybe myself and Andrea could support with that. I'll certainly support sharing the details of that session. And if you feel, if those members on the call feel that it's of use, you've kindly offered to consider creating additional sessions if there is an appetite for it. So apologies to cut us short. I think that's been really helpful session. Thank you so much for your time, Francis. It's been great working with you the last few weeks. Please keep me in the loop, and I'll support. And I'm sure that Andrea and Mark will support as much as we can for Linka as well. Thank you to all those who have spent the time staying on the call. We really appreciate your attendance. Hopefully this is helpful. And please, if you have any other requests or actions that you'd like us to consider from this session, please do pop it in the chat, and we can follow that up as together if we can. Lovely. Anything else from yourself, Francis?
Well, what I'll do is I'll reread all of the messages in the chat function afterwards to make sure I didn't miss anybody out. And obviously, as long as I know who you are, where you are, I could maybe email you. I'll go through that, and I can email the homes who've asked some questions. And I mean, obviously, Lindsay, I think we can pick up a conversation, I think, and to see if I can help in any way. But just to let you know where I sit in all of this, I don't work for the bladder and bowel team. I work for Ontex Healthcare, and we support the bladder and bowel team, and we basically sing their song, if you see what I mean. They have their own way of working, and I just reinforce that message. I can't override what they do, and I can't prescribe. I can make recommendations, but ultimately it's up to them.